do. So this is what an auditory brainstem response looks like, this pattern of electrical potentials here. So over on the left here, it's a bit hard to see behind the TV, is where the sound is presented, and then we measure for 15 milliseconds or 15 thousandths of a second what's happening in the brain after that sound has been presented. And what you see here in someone with a normal auditory pathway, as in this case, is we get this pattern of peaks and troughs occurring there. Okay, so that's what a normal response looks like. These are some responses here from some of the Friedreich's patients that we've seen, and you can see the bottom ones here, they're actually pretty much flat, which doesn't mean that the sound is not getting through to the brain, because they can hear sounds, but it's being distorted along the way. Okay, so many people with Friedreich's have no response at all, or if they have one, as in the second tracing here, there is a response there, but it's a lot smaller than normal. Okay, and these are the sorts of responses that we see early on in the Friedreich's course. The ones down the bottom are people who are a bit further advanced. Okay. And this is the testing that's been done in the studies that I mentioned previously in scar patients, showing that 50 to 80% of people have abnormal results on this test. So there's something odd about the way the electrical signal is passing through the pathway. Right, so we'll be repeating that in the patients that we see to see whether we get the same sort of problems. Okay, so that's the responses measured electrically from the scalp. All right, the next part of the testing is auditory processing. So we're looking at perception of timing cues. Okay, now I don't want to go into this in too much detail, but basically we're looking to see with a sound that's changing very quickly, whether you can perceive these rapid changes that are occurring in sound. So the subject response in this case, you have to indicate somehow, perhaps by tapping a table or saying when you've heard a sound that has these rapid fluctuations. And the testing takes about 20 minutes. Now, I have a little bit of video of here. This is my son. When he's 14 now, so he's certainly not interested in being videoed anymore. But he was a little fellow here, and he's actually doing one of the tests that I'm talking about, this temporal processing. So I'm not sure if you're going to be able to hear it, but we'll give it a go. So what he's going to hear is a series of sounds that are all the same. They go psh, 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 and then somewhere in the sequence there's one that's a bit different. It sounds like ch, ch, ch. Okay, when he hears the one that's different, he has to put the candle in the cake. Can you hear that? Alright. So in adults, obviously, we won't have the candles in the cake unless you particularly want to, but you can just tap on the table or something when you hear the one that's a bit different. Okay, so that sort of testing takes about 20 minutes. It's pretty easy to do. Alright, here's another reference for you. Speech perception testing in quiet and in background noise. Okay, now the test in this case, it's a word test, so it's a sequence of single words that are presented, and they're presented in quiet and in different levels of background noise. And the response in this case is you have to imitate what it is that you've heard. So if you can hear it clearly, you'll be able to say it back correctly. If you're struggling to hear it clearly, then you're not going to be able to imitate. Okay, this test takes about 30 minutes, so here's my long-suffering son again. Did you hear the sounds?
Yeah.
Oh, yeah. All right, well, we'll keep going with the test. Okay, so he's doing the CNC word test here.
Hush. Hush.
Okay, so the words are coming through a little plug he's got in his ear, and he's repeating it.
Shoo. Huck.
He was a bit hesitant to respond to that one. Alright, so that's in quiet. Now there's some background noise going constantly in the background. And so we've produced a score based on the number of sounds in each of these words that he gets correct. So obviously starting to get uncertainty because the background noise is coming up, but here's the hardest one. Alright, so that's the speech perception. Okay. So we have some norms, so what we expect people to get in these various listening conditions here. So on this axis here we have the phoneme score, which is the number of speech sounds that he was able to correctly repeat, or the percentage. So 100% up the top is where you can get them all right. 50% obviously we're getting half of the sounds correct. So just going on the bottom here, the one on the left here is in quiet. This pink area here represents findings for normal adult subjects. And you can see that in quiet they're scoring pretty close to 100%, as you would expect in their ability to imitate these sounds. As we move across here, it's getting more difficult. The amount of noise is increasing, so the score is falling away. So that people at 0 dB here, which is, it's about the level of background noise in a normal conversational environment. We're probably pretty close to that in this room, actually, with the fan going. We're down to around about 60 to 70% correct on those sorts of tests. Now, I'll just show you some results here for some of our Friedreich's ataxia people. And you can see that they're quite different. So in quiet, they're doing okay, but as soon as there is any background noise in the other conditions, their performance falls right away. So that when we're over on the right there, again representing normal conversational environment, basically getting no understanding of what's being said to them at all. Okay? And again, these are people who can hear very soft sounds, so detecting sounds is not the problem. It's the sound is being distorted in some way by their neurological changes that are occurring. And that's what we're looking for in the SCAR group as well. And in the Friedreich's patients that we've seen, we have started looking at ways in which we can help these patients who are having these sorts of problems, fitting them with devices where, for example, they might wear a little headset, and the person who's speaking to them might have a transmitter that they wear around their neck. And if they're in a noisy environment, it's as if the speaker's mouth is that far away from the person's ear, right? So they can hear much better in background noise. So again, I'm certainly very interested in what practical things we might be able to do if we find some problems in people with SCAR.
Can I just suggest you plugging in on that tree? Just on the right-hand side of the right up to the center.
Right.
It's over the side. Don't want you to lose power.
Alright, we're almost there. Okay, so just some details about the study then. This work will be carried out by my Master of Audiology students next year. The data collection will be between March and August, so there's a couple of months over which the collection is occurring, and that fits in with their academic schedule. The testing typically requires somewhere between 1 and 1.5 hours to go through all of the tests that I've mentioned, and again it can be done in your own home. So my students, provided you don't live too far away from Melbourne, are prepared to come to you, and I usually bring a cake or something. All right, and in terms of the study, we're looking in particular at SCAR groups 1, 2 and 6, because they're the ones for whom the previous studies had shown some differences in the auditory pathway. But anyone is welcome who has SCAR. So other groups as well are quite happy to sign up. But I'm hoping that in each of these 3 groups we might get somewhere near 5 to 10 subjects. So, all right.